Hello, everybody. I hope you're having a great day today. I'm so excited to be with you and share some tips and tricks with you guys to help you manage your patient's comfort and give you the roadmap to success. And you know, we are in dentistry, which is such a fabulous profession, and we're so fortunate to be a part of something so great and getting to change patients' lives every single day. So here's the deal. I'm here to share some things that have worked well for me and for my clients. And by listening, you will be able to learn how to make your patients more comfortable, how to be a better team member, how to wow your patients, and how to have a happier practice every day. And so since we're going to spend the next few minutes together, I'd like to share just a little bit about myself. You know, when I started my practice several years ago, I had to go through some struggles of hiring and finding and training team members. And, you know, I made a lot of mistakes. In fact, several times I thought to myself, you know, I might want to quit this and go work for someone else. But the things that I'm going to share with you this evening have helped me to create a successful practice. And by focusing on your patient's comfort, that's what brings me into speaking and consulting. And that's why I'm here, because I love what I'm doing now and I get to work with some of the best patients, and I have a fabulous team, and I also get to work with fabulous clients. And so enough about me. Let's focus on you and your practice. And so my name is Dr. Tanya Brown, and I'm thrilled to be with you this evening. So I hope you are all ready to learn some great tips. So many patients have a fear of dentistry, and you know, we really do have the power to make them comfortable and to help them be more comfortable. And I do want to thank Perel Pharma for supporting this continuing education, because so many doctors tell me that they're working harder than ever for less than stellar results, unfortunately. And so today we're going to focus on making your patients comfortable and helping them say yes to your recommendations. So if we look at these top 100 fears and we think about number 7 is claustrophobia, number 20 is fear of needles, number 27 is the fear of the unknown, number 57 is fear of doctors, number 71 is fear of pain, number 82 is fear of loud noises. It's no wonder that 75% of adults have some dental fear, because out of those top 100 fears, the ones that I've listed here have some potential to be connected to dentistry. And so it's our job to make our patients more comfortable and help them to become missionaries about your practice, and share with others how easy and comfortable visit was in your office. So, you know, I'm sure many of you have heard the story about the man who was walking along the ocean one day, and as he was walking along the shore looking at the waves crashing, he saw a young child throwing something into the ocean. And as he got closer and closer, he noticed that the child was reaching over and picking something up and throwing it into the ocean. And the child would reach over and throw something, pick it up and throw it again into the ocean. And then he'd walk a little bit further and he saw the child up and throw it into the ocean. And as he got closer and closer, he said, "Hi, good morning. May I ask what it is that you're doing?" And the young child said, "Yes, sir, I'm throwing starfish into the ocean." And the older gentleman said, "Well, why are you throwing starfish into the ocean?" And the young child replied, "You know what? The sun is up and the tide is going out, and if I don't throw them in, they'll die." And as the man sat there and thought about what the young child was doing, he thought about that there were thousands of starfish all over the beach and all over the sand. And he said to the young boy, he said, you can't possibly make a difference. And at that second, the little boy reached over one more time, leaned down, picked up a starfish, and threw it into the ocean. And as he did that, he said to the man, it made a difference for that one. And so this is how your fearful patients feel when you make them comfortable, because it makes a difference to them and it's so important to them. And so the first place, if you want to make your patients more comfortable, is we have to think about and focus on what's important to them. And so doctors, today I'll be focusing on many of the things that are important to your patients. So please listen carefully, because I know these are the things that are important to them. And if you're a team member, listen and take notes on the pieces and parts that apply to you and what you bring to your patients and to your relationship with you, whether you're an admin team member, a hygienist, a dental assistant, a lab technician, a dentist. So it's important that we all focus on what's important to our patients. And so one of the things I want to share with you is one of the best inventions and products that I personally use in my practice every single day, and it's called Dental Vibe, and I describe it to my patients like this. It's like a Sonicare toothbrush, and it makes this part really easy. And so I had a patient last week, and she said, well, when are you going to give me the shot? And I told her, I said, we already did. And so it made me laugh, and we kind of chuckled a little bit, and she's great, because part of making your patients comfortable is eliminating and reducing that dental anxiety. And this saying and quote here is from the Dental Vibe website, that millions fear the dentist because of potentially painful procedures, but that does not have to be the case. And so if you're not using the Dental Vibe or you haven't heard about that, check into it, because it's something that I use and has really helped make our patients more comfortable and to reduce their anxiety. So we can then do a better job for our patients. So these are a few examples of some of the topical anesthetics that I have personally used in our practice for our patients. The first one's Diclonine. It's a rinse, and I get it from a pharmacy. You can have it compounded in your area, but it's very for perio patients or for scaling and root planing. Patients love it because it's quick, it's easy, there's no injections. They rinse with it for 30 to 40 seconds, and it actually works. You know, when we first got it and first tried it, we always test things before we use them on patients, and so we all took a swig of it and rinsed with it, and we thought, there's no way this can, create an anesthetic feeling. And then about 10 seconds later, it started to take effect. So I promise you, it works really well. And so we just charge a nominal fee for that. Benzocaine, of course, most of you probably use this in your practice already before injections, and this really helps to numb the tissues so that patients are more comfortable. And then Stevens Pharmacy has some very effective dental topical anesthetics. I've used several of their products, and they compound a lot of things, especially for dental practices. So if you're not familiar with them, you can look them up online, but they have some great things for you to use in your practice. So I hope that you'll check out some of those topical anesthetics. This is another tool that I use in my practice to help patients be more comfortable. I use Citanest, and usually I will use this first, and I tell patients that, I'm going to give them a little cocktail. And so the pH of Citanest is fairly close to our tissues, and so the local irritation and trauma is minimized, and therefore it makes your patients more comfortable. So a product that I use in the practice, and it has helped our patients to be more comfortable. And so check that out, and hopefully that will work in your practice as well. Another type of anesthetic, while we're on anesthetics, is another great product that I've started using recently. I used to use Septicane or Articaine. Septicane's the brand name, Articaine is the anesthetic. And I was introduced to Orablock, which is Articaine as well. That comes in 1 to 100 and 1 to 200,000. Colleague who's told me how great it worked for them, and I did some research and I liked what I read. I found out that it had a rapid onset, that it actually had a higher potency than Septicane. It costs about 20 to 30% less than Septicane, and the way that they processed the carpules really allowed for improved safety and protection for my patients and for us. And so, I felt like this was a win-win. And so this is another way that we help make our patients comfortable. And so now let's think about and talk about how people make decisions, because we all make decisions from the moment we wake until the second we rest our heads. And you've probably heard the saying that we make decisions based on our emotion, and then we rationalize that with logic. Well, it's true. We do need that emotion to make decisions, and without getting too bogged down over the next few minutes into neuroscience, we all make decisions on emotion, and then we do back it up with logic and facts. So let me share with you, if your patient comes in your practice and they have a great experience and they're comfortable and they're relaxed, then they can make better, quote unquote, decisions about their health care or about your treatment recommendations. And they also feel good, which is the emotional piece in your practice. They feel listened to, they feel heard, they feel well cared for, they feel comfortable. And when people feel good about the service that they're receiving or the products that they're purchasing, then they tell others, as well as they say yes because they have some level of trust and rapport with you and your team. And so when patients are relaxed, they can make better decisions. So the more we can help them become comfortable, that is the roadmap to our success in our practices, as well as our patients' success in becoming healthier and making the best decisions for their health care and for their oral care and for their overall health. Now I want to switch gears a little bit, because so many dentists tell me that they want to get off the treadmill. And I want to share with you how to get off the treadmill for good, because I'm here to tell you it can be done. I've been practicing for over 17 years. I have a fee-for-service practice in a very insurance-driven area, and that is truly what calls me into the consulting world, because I enjoy helping other dentists do ethical dentistry and getting paid what they're worth, and team members paying their teams what they're worth. So here's the deal. If you're having difficulty getting patients to say yes while you're on the plans and participate with particular plans, it can be more difficult for patients to say yes when you're off the plans. And so this is why I've been a student and mentee of Linda Miles for many years. And this is why she teaches strong, effective communication and leadership skills, as well as why I do. And it's so important that we educate our patients about the conditions in their mouths and their bodies and how that's linked and fits to them. And so Linda and I are having a blast putting together out, laying that foundation to have that ultimate team. So here's the good news. Because if you want to get off the treadmill for good, I want to reassure you that patients are still saying yes. Have you been by the mall lately and walked by an Apple store? Because all of the ones I ever walk by are packed and they're thriving. And so patients still say yes when they value resting in. There's a local restaurant in our area, and it reminds me of the story. The restaurant actually opens at 7 a.m., but people start lining up at 6:30 now a.m. Now, I want you to imagine if people were lining up at your office door 30 minutes before you actually opened. That would be every dentist's dream, unless, they were all emergency patients and weren't already scheduled. But can you imagine having patients lining up to get into your practice and to see you and your team? What a fantastic way to take care of patients and help them be more comfortable and help spread the good news about what's possible in dentistry and healthcare. And so, if you want taking a significant patients and on your practice, one of the best places is to start with your new patients. And here's why. Because they don't know how you used to do it. And so when you're making changes, they don't really have a reference for comparison. And even if you don't get it quite right that time or for that patient, they're not going to know it because that's their first experience with your practice. So new patients are an easy place to start making a significant impact on their experience as well as in your practice, because I believe that the first visit in your practice is the most important, and it truly determines the treatment that your patients will do in your office and which patients they will refer to you. Because that first new patient experience, and when I say new patient experience, I mean from that very first phone call all the way through their actual appointment, that's building that relationship of trust and rapport. And so, here's a bonus tip for you guys. If you are using a new patient call form or a call sheet or some sort of information gathering tool when new patients call your office or email your office or send you a text message, if you're using something that's working well, great. If you're not using something that's working well, or you've thought about ways, I'd like to gather some additional information, or I'd like to know some additional pieces of information so when our patients get here, we're prepared for them, I'm happy to email that to you. I'll share my email at the end. So just email me and I'm happy to share that new patient call form with you because it is such a valuable tool and it truly does set the stage for that patient's relationship of trust with you and your practice and your team, as well as, setting the stage for case acceptance. So that reminds me of a story, and it also reminds me of how I started to get off the treadmill for good. So I'd like to share that with you. Shelly came to my office and asked about improving her smile, and she wanted that quote-unquote Hollywood smile. She hated the spaces, the color, the worn edges, and she had some major dental fears. And so when we started talking and looking at her case and, looking at the x-rays and the photos and the diagnostic records, and we started talking about fees, she told me that she was going to be sacrificing her dream of buying a Harley Davidson motorcycle because she wanted a new smile. And of course, I did not want to be the one to take away her dream of a Harley and riding with her husband. And so what a challenge for me and my team. How do we help this patient get what she wants? How do we help her overcome her fears? How do we help her feel comfortable? And those were some of the thoughts that went through my head. And it was easy to get bogged down in the monkey chatter in our own heads. And it was easy to lose sight of what's possible. So I want you to write this down. And if you're listening to this remotely and can't write this down, you're driving or, not at a place where you have pen and paper, I want you to think about this. I want you to remember this to use this later. Whatever happens in your schedule, whatever happens on a daily basis, whatever's not going the way that you want it to go, however late your schedule is running today, you have to remember this. Think about what is possible and help create awareness for your patients. Because some patients, like Shelley, come in knowing what they want. They bring you photos from, People magazine. They show you pictures of what they want their smile to look like. And then some patients come in and they have no idea the conditions of their mouths or the implications of those conditions. And so this is where you, dental team members, come in, because you get to partner with your patients and help create that awareness for them to understand the benefits and what's possible. So dental team members, I want you to listen up, because these next few slides are especially for you, because you play a key role in helping our patients create awareness of what's possible and the impacts of their conditions. So here's a question that, if you're not already asking this, I want you to start asking this tomorrow. Because when we started asking this question from the very first phone call, we were amazed at what patients told us. So write this down and ask your patients this question. What is most important to you that we cover at your first visit? And then pause, because I can guarantee, unless your patient has called my practice and a few others, they have never had anyone ask them this question. And this question helps to open the channels of communication, and it helps your patient to understand that you care about what's important to them. And that goes a long way to making them comfortable. Here's to get your team members to start giving you a list of your new patients the week of their appointment, the week before their appointment. So my team on Monday, they give me a list of all my new patients for the week. And it's my job as the leader and as the dentist to call those new patients. And the call goes something like this. Hi, Mrs. Jones. This is Dr. Tanya Brown, and I'm calling to introduce myself to you and let you know I'm looking forward to meeting you tomorrow. Megan told me you were interested in whatever she may be interested in, Invisalign, dental implants, replacing their missing teeth, a smile makeover, they have cavities, whatever the patient tells her that's most important to them. And then I let the patient talk. And they usually will share some tidbits with me that are really important about their story and about their history. And then I make sure that they know how to get to the office and that they've already filled out their information, because that uploads into our system. And I say, you know what, I'm looking forward to meeting you in person and putting a name with the face. I'll see you tomorrow at 10 or tomorrow at 8. And if you really want to connect with your new patients, that is a very effective way to do it. And guess what? Your new patient no-show rate goes to almost nothing, because what new patient is going to stand up the doctor when the doctor took the time to call them before their appointment? Almost none. And so if you really want to decrease your new patient no-show rate, and I'm sure all of you that are participating in this program in your area, you've probably had 1 or 2 new patients over the years no-show, because I know I used to. And the way that we overcame that was I call those new patients before their appointment. This is different than a confirmation call. This is different than their initial phone call. This is simply an courtesy call from the doctor saying, I'm looking forward to meeting you. Is there anything that I can have ready for you tomorrow? I want to make sure you know how to find the office, and, connecting with them. And then it's your job to share that at the morning huddle with your team. So then that saves time at their appointment, and you've already created that connection with your patients. That brings me to my next point about creating awareness. We mentioned this a minute ago, but one of the most important things about case acceptance is creating awareness. And I have to give credit where credit is due. I learned this from Dr. Frank Spear, and he said, every patient comes in with a different level of awareness and desire for care, or value of dentistry, value of care, because they do come in with different levels of awareness. And so we have that conversation up front to determine where they're starting and where they want to go and what some of the goals they have for their smile. And this is where dentists and members get tripped up, because there's no one cookie cutter way, no one cookie cutter process for every single patient. Some will want everything, some will want nothing, and everyone else is in between. So if you don't know where you're starting and you don't know what your patient wants, then you risk overwhelming or underwhelming your patients as you work through your new patient experience. So here's your first homework assignment. Meet with your team and decide what you want to include in your new patient experience. What information do you want to gather? What photos do you want to take? What do you want to ask on the phone? So that you can meet your patients where they are and help create that awareness and the understanding of what's possible. Because the bottom line is this: if you want a roadmap to success, that's really about creating awareness, because case acceptance is really about creating awareness for your patients. Any logical patient will say yes when they understand the benefits and the implications of their conditions. So this is critical. Case acceptance is not a money grab. Let me repeat that. I'll say it again. Case acceptance is not money grab. And team members, you have a ton of influence with your patients because they trust you. They've spent an hour with you, or spent time with you in that new patient process, or they've talked to you on the phone, or you've given them a tour of the office, because people know when they're being sold. And so our role as healthcare professionals is to walk that walk of trust and help patients understand what you see and what you would recommend if it's you, and what's in their best interest. And so team members, this is where you come in with effective communication skills, because case acceptance is not about money. It's not a money grab. Case acceptance is truly about awareness and creating awareness and partnering with your patient for a lifetime of good dental health. Now, some of you might be thinking, gosh, I already have such a busy practice. How am I going to do this? I'm already seeing all these patients. I don't have anywhere to schedule patients as it is. How am I going to take photos? How am I going to do a better new patient experience? How am I even going to have time to meet with my team to discuss these things? So here's the bottom line. If you're serious about getting off the treadmill and making patients more comfortable and starting on that road to success, then you must create protocols for everything. Here's an easy one. You can start with your emergency patient protocol. Every single dentist on the planet can give you a working diagnosis in about 2 seconds if the dental assistant or the dental hygienist comes to them with a few details about that emergency patient. For example, if your assistant comes to you and says, you know what, the patient's hurting, they've been up all night, the tooth's painful to percussion and palpation, almost every dentist that I've ever met all over the world could give you at least a working diagnosis and at least start thinking that the tooth is most likely pulpily involved and may need some sort of endodontic treatment. So here's how you create your emergency patient protocol. You create a list of questions that you want the answers to, so that then your team members can be delegated and ask those questions to gather that information to help you make a working diagnosis. So for example, how long has that tooth been bothering you? Is that tooth waking you up at night yet? Is it sensitive to hot yet? Is it sensitive to cold yet? You get the idea. And then any dentist can walk in, meet the patient, look at the information that the assistant or the hygienist or the team member has gathered and help get that patient comfortable. Because an emergency patient, that's what they're calling your office for. That's why they're coming in. They have something that is urgent and that is hurting and that they need your help. And so let me share a story with you and a different perspective with you. Because over the years, I've had many dentists and team members tell me, gosh, I don't want to bother with emergency patients. They'll never come back for treatment. The reason why they're emergency patients is because they don't follow what they're supposed to do. Well, maybe so, but maybe no. Because I want to share a story about Nancy. She first came to my office as an emergency patient. Now, you can see this photo of her before and after. And we didn't do that on the first visit, but we got her comfortable on the first visit. And then she started opening up because we started talking and I was listening and she started sharing that she hated her teeth. We started talking about what she didn't like and what was possible. And it wasn't on that first visit, of course, because our first objective on that first visit was to get her comfortable. And so when she returned to the office, we talked about what was possible, and we went through the process and gathered x-rays and photos and diagnostic models and FACEBO and centric relation bite records and all of those pieces, and we did a wax up and all those things. And we sat down at a consult and started talking about, what was possible, and I showed her photos of other patients in similar situations. And guess what? She decided she wanted it all. She did it all. She did root canals, she did crown lengthening, porcelain crowns, she has an occlusal guard, she did periotherapy. Of course, it wasn't on the first visit, but when we built that relationship of trust and rapport, this patient, a full mouth or at least an upper arch reconstruction, started as an emergency patient. So if you want to do more dentistry and you want to take better care of patients and you want to help them get more comfortable, calling your practice and already looking to you to get them comfortable. Because I promise you, a lot of them will complete treatment. Some of them might not, but a lot of them will when they're given the chance. Another thing that dentists tell me is they want to do more cosmetic dentistry and they want to do more aesthetic dentistry. Well, if that's you and you want to do more cosmetic dentistry, then your patients have to see what you see. And so one great way to do that is for you to take a ton of photos. And one of the best tips that I have for you today for communicating with your patients and getting a higher case acceptance is photography, because photography instantly creates awareness. And one of the ways that we use those photos is we use two monitors. So there's a monitor in front of the patient, and then there's a monitor that we use for charting behind the patient. And so we can show the patient what we see, and my hygienist will take photos during her hygiene exam, and then they can have those on the screen and learned about. And so photos are a great communication tool between clinical team members and your patients to the lab. And so I promise you, the more photos you take, the more dentistry you will do. Guaranteed. You can bank on it. Because when patients see what you see, they start asking, what's that dark spot? What's that shadow? What's that black thing? Are those my teeth? And they become interested in what they're seeing because they never look in the back of their mouth. We're the only crazy dental people that do that. And so taking more photos really help show your patients what you see. So if you need a photo guide, email me. Again, I'm happy to share this with you. If you have a camera and you're not using it, please dust it off. Start using that camera and take photos. Decide on 2 photos that you want to take on every single patient and start with those, because it will make a difference to your patients and it will help make them more comfortable and pave your road to success. Now, I have one final tool to share with you. This is called the Trial Smile. And this has dramatically increased our case acceptance because this also helps patients see what we see. And so normally, I mentioned earlier that we take records and diagnostic models and, we send that to the lab for a wax up. When patients come in asking about, reconstruction or restorative dentistry, cosmetic dentistry, and they're wanting to change their appearance, generally I'm going to have my technician create in wax their ideal smile or what's possible. And so then, and on that wax up model, we make a clear matrix over that model so that patients can visualize what we see, and they actually get to try it in over their teeth. And so I'll show you how this works in just a second. But the photo here on the right shows the matrix off of the model. And so then you would use the easiest thing to use is like a bisacryl material like Luxatemp, Perfect Temp, Pro Temp, Integrity, one of those type bisacryl provisional materials. But you load a small amount of the matrix, and then you put this over your patient's unprepped teeth. So you have not prepped their teeth. This is over their unprepped teeth. This generally we use this at the consult appointment so they can see what's possible. And we let the material set for a minute or two, and then we gently peel the matrix off, and then the bisacryl is still on the patient's teeth. So it shows them what's possible. And so this is a great, easy, inexpensive, quick tool to help patients visualize the results and the possibilities. And so I was teaching a few years ago a new patient experience course in my office, and I had a young dentist that was there, and he was so funny. He loved what all we were teaching, and he was so excited, and his team was there, and they went back to their office, and on that Monday after the weekend session, he called me and he was all excited. He said, "You're never going to believe this. You're never going to." I had my first patient. We say yes when they can see what you see. And so it's a tool to help patients see. So I want to share another case with you because I want to show you how we used photography for this patient, and this was what helped her to say yes. And I'm not showing you these cases to show off my work. Probably any of you on this program could do this dentistry. And this patient actually didn't come in asking for cosmetic dentistry. She came in asking for a better quality of life, because what was happening is she's actually related to me through marriage. She married my great uncle, and he was having difficulty chewing, and her poor partials had been added to, subtracted from, adjusted, lengthened, shortened, you name it. These poor teeth have had it. She had missing teeth, she had congenitally missing teeth, she had bonding, crowns, PFMs, tooth wear, malocclusion, root canals, fractured teeth, you name it, she had it. And, she really, like I said, didn't come in asking for cosmetic dentistry. It was really about a better quality of life. And so these are some of the tools that we helped her go through to help her say yes and to realize what was possible. And so one of the first things was we took some photos, and then of course we took some records and did a wax up, and then we showed her the trial smile. So I'll share those. So these are some more of her before pictures, and you can see it's just years of dentistry and addressing things as they break and fail and wear out, and but here's what we showed her what was possible. This is her trial smile, and this is a integrity, and so this is over her unprepped teeth, and that's why you can see some bleed through on the upper. Prepped her teeth at all yet. And I sat her up in the chair and I showed her the mirror, and you know what, even in her 80s, because she was in her 80s when I saw her first, she sat up and she said, "You mean my teeth can look like that?" And I said, "Yes, they can." I said, "But it's really, Jeanette, going to be very difficult to do this one tooth at a time. We really have to address things comprehensively." And you know what? She decided, yes, that's what I want. That's what I want to do. And so the good news is she did it all. So here's her before and here's her after. She did it all. We restored her entire mouth, and that was such a privilege for me to get to help her. And what a cute couple. And they'll probably live to be 100 and outlive me and everyone else in the family. So that's why I'm in dentistry, because it's about the quality of life and the comfort that we can bring to patients and help show them what's possible. So remember that story that I told you at the beginning about Shelley, my favorite patient, who came to me to restore her smile, and then I spent some time with her and we started talking and built that relationship of trust? Well, here's the good news. She ended up restoring her teeth and having that gorgeous Hollywood smile that she wanted. And remember I told you she was going to sacrifice that Harley-Davidson motorcycle? Well, here's the good news. When it was all said and done, she got it all. Not only did she get a new, healthy, attractive smile and renewed confidence and a great appearance, but she also got the Harley. And she was able to enjoy life and have fun and be confident partly because of her dentistry and her health and her renewed self-confidence. So that's so much fun for us to get to have that impact patients' lives of making them more comfortable and helping them to say yes. So I want to share this quote with you guys, because success is no accident. It is hard work, perseverance, learning, studying, sacrifice, and most of all, love of what you're doing. And you can probably tell that I get a little dental geeky and I get passionate about dentistry, because I do love what I do. Not only seeing patients, I have a full day of patients tomorrow. I had a full day of patients today, but I also love sharing with others about the things that have worked in my practice and for my consulting clients. And so this is very true, because there will be people who will work very hard, and there'll be others who don't really want to work very hard at all. But you are investing your time to learn new ways to help make patients more comfortable. And so you will make hard look easy because you are investing in yourselves to help your patients and for the benefit of your patients. So my hope for you is that you all have very successful practices and happy patients that are missionaries for your practice. And so thank you for listening. Answer some questions here in just a second. I hope that you will learn, I hope that you will use some of the new things that you learned and you find some new ways to make your patients more comfortable and make your practice more successful. And I hope to see you on future programs and on our Ultimate Team Mastery. And here's my email. If you want that new patient phone sheet or the photo guide, just email me. I'm happy to share that with you. Anything, that I can do to help make your patients more comfortable and help your practice grow. So I have a couple questions, and one of the first questions is, when doing a trial smile, how do you deal with proclined teeth that would probably need a root canal first or probably need treatment? And so what we have to tell patients is, this is a mock-up of what's possible, and if they have a lot of space between their teeth or their teeth are very proclined, then you have to let them know that, hey, we're going to be changing that position either with orthodontics, restorative dentistry, reconstruction, whatever, orthognathic. And so they have to use their imagination a little bit with the trial smile. Yes, it is more difficult if the teeth are very proclined because, obviously you're wanting to move those teeth, but you haven't done that yet because they're not prepped. So it's still possible. You just have to kind of maneuver, and that's why I like the clear material, is because it's very flexible. If you use something like a putty matrix or something like that that's very rigid, you probably wouldn't. It would probably be very difficult to do that, but by using a flexible material, you can still, form it over their teeth and help them to kind of visualize and, help them to understand that this is why we need to move your teeth and this is why we need to restore your teeth or, do endo or whatever, because they're not in the right position. So it's an easy way to use things. The next question is, can you explain again exactly when and for what procedures and for how long you use the diclonine rinse? And the diclonine rinse is a topical anesthetic and they rinse with I think about a half of an ounce, something like that. It's a very small amount. And we have patients rinse for about 30 to 45 seconds. We use it most often in our hygiene department. So for periodontal procedures and or scaling and root planing, if it's, scaling and root planing of a few areas, that may be all the anesthetic that they need because that keeps them comfortable. It numbs the soft tissue. And so then, with the ultrasonics and hand instruments, my hygienist can keep the patient very comfortable. So again, it's a easy product to use. We have it compounded with a local pharmacy, and I've purchased it at a couple different places, but it works really well. And so I've used that for probably 10 years, and patients are very appreciative because it is comfortable. Some of those patients, that have sensitivity when they come for their hygiene appointment, you can also use it for them because it helps make them more comfortable. And so sometimes I will use it when doing restorative dentistry before we place the topical, like benzocaine, if we have a patient that's really, really nervous and they, are so fearful of the dentist that they don't want to know anything, feel anything, see anything. But most often we use it in the hygiene department, and it works really well there. One thing you do need to know is that if they swallow a little bit of it, it will kind of numb or tickle their throat. And so you want them to be aware that that will go away. It's topical, but the topical anesthetic will last probably 30 to 45 minutes, much longer than the topical benzocaine. So it's a really nice product to use. Another question is, do I ever speak directly to patients about the cost of treatment? So yes, if they ask me a direct question, I'm happy to share the fees with them. And usually they're asking at that first visit because, it's a new practice or they from another practice, and so they have no idea what things may cost. And so generally at that first appointment, I don't know yet what they need or what they want. And so that's what that first appointment, that new patient experience is designed to find out what they need and what they want, and to gather that information and then report back to them at the consult appointment. And so when they generally ask a direct question about the fees, I will say to them, that's a great question. I'm happy to give you all of the fees, but let's find out what you want first and what you need first and what's in your best interest, and then we can talk directly about the fees. And if they still press me on it, let's just say they're asking about a dental implant, then I may say, the range, it would be somewhere around $2,000 to $2,500 based. And then I ask them a question. I actually ask them, do you have a budget in mind? Have you thought about what you want? What's most important to you? And so then that helps to open those channels of communication and helps get them talking about what they want. And so sometimes patients surprise me because what we think is expensive is all relative. And it's relative for our patients. So some patients might think that $100 is expensive. Some patients might think $1,000 is expensive. Some patients might think $100,000 is expensive. And so it's really relative, and we have to be careful as healthcare providers, as dentists, as team members, not to assume what our patients think is expensive. And so when a patient says, wow, your fees are expensive, then I simply say to them, you know what, probably go and find this cheaper. You could probably go and find it more expensive, but this is what our fees are, and we're proud of our fees and proud of the care that we provide. And we want you to be proud of the dental care and the dentistry and your health that you have here. And then usually patients, they're respectful of that. And, if it's somebody that keeps pressing you on it, then we can go deeper in that conversation. But most of the time, once you start to answer those questions and they understand, they're listening, and you're going to help them figure out a way to fit this dentistry or fit what they want into their life and into their budget, which is another phrase that I use, that relaxes them and it helps them feel more comfortable because they know that you have their best interests at heart and it's not about a money grab. So great questions. Another question, I'll have time for a couple more. How do you build out an intro appointment, and how long do you allot, or do you set up a hygiene appointment and intro exam? So let me answer that in a couple parts. Generally speaking, most patients call your practice and they say one of two things. They say, do you take my insurance, is the first question. And if they don't say that, they generally call and say, I need a cleaning. Well, the reason why they say those two things is because that's what they've always said at every other dental practice they've ever called. And those are the questions that they've also had asked to them. And so I would challenge you to answer those questions, of course, but to help your patients think in a different way. And so once we start asking what's important to them, then we can schedule the appropriate amount of time for them, because it may be something that's a 30-minute appointment. It may be a 2-hour appointment. So generally speaking, once we find out more about what's important to them, and that's the question I gave you earlier, then you can schedule the appropriate amount of time. Because what's terrible is if you have a patient that needs 2 hours and you only have 30 minutes for them, then that's a problem, because you're probably going to underwhelm them, and you're probably not going to have enough time to gather all the information that you need and they need to help them make the treatment choices. So if you start from the get-go, from the phone, that first phone call, and really find out what's important, then you can structure it. I also believe that the best full new patient, comprehensive, whatever you want to call that, the new patient experience, I believe that the best new patient experiences are on the doctor's schedule with a new patient coordinator, and that new patient coordinator generally is an assistant or has a clinical experience. It could be an admin, it could be a hygienist. Honestly, I have seen new patients every week in our practice, and I've found over the years that the best way is to see them on my schedule with an assistant. And so generally speaking, for comprehensive adult patients, we allow 90 minutes for that appointment. If it's an emergency patient or an urgent care patient, then it may be a 30-minute or an hour appointment, depending on what they're telling us on the phone. And if it's a patient that has been seen every 6 months, they're religious on their hygiene appointment, and they're absolutely insistent on a hygiene appointment, then we'll schedule them on the hygiene schedule. But generally speaking, for adults that are calling and it's been 5 years, 10 years, 20 years since their last visit, or they tell you on the phone that, you know, their mouth's a mess, we're not scheduling them on the hygiene appointment for a prophy or for perio. We're scheduling them for an exam, x-rays, photos, those kind of things. And that's the best way to help spend the time needed with your patients to listen to what's important to them and gather the information that you need. I have one more question. Are there any tips that I have to how to deal with patients' parents in a pedo office? Well, it's funny you should ask, because I actually was a pedo assistant 100 years ago. And in pedo, you actually have the actual patient, the child or the teen, and you have the parent. And so I'm not sure where you're going with how to deal with patients' parents, but one of the things that we did is had the parent come back into the treatment area as long as the patient was behaving and doing well. And so we used that as a motivating incentive for the child to on their best behavior. Now, you know as well as I do that there are some children that do worse when their parent is present. And so those parents, we generally would have either wait in the reception area or stand in the hall so they could see, but the child couldn't see them. And that worked out really well. The other thing is to really make sure that you're communicating in a very effective way of what the steps are, what you need from the parents, what they need to do at home, any instructions, because yes, you have two sets of patients, quote unquote, that you have to deal with in an office. And so it's a lot of fun, because children, you know, when they have positive experiences, that sets them for a lifetime of good dental health and not being afraid. And we always want to have those positive dental experiences from the very first visit in their in your practice and in dentistry, so that then they're comfortable for a lifetime. So great question. Let me see. The one last question: what do we charge for the Trial Smile Wax Up? Is this something you offer at no charge? So I charge a fee for the diagnostic records, and that includes the wax up and the Trial Smile. So there's no additional charge, and patients appreciate that, and they pay that, of course, when they have those records taken, which is generally at that first visit. And so, you know, you can do it where you charge each piece individually, but I think it's nice to be able to provide that as a service and as a surprise to patients, because they really enjoy it and it really helps them see what's possible. So, and then one last question is, how long do I keep it on? And I only keep it on for just a minute or two, long enough for them to see it, take photos, and look in the mirror and see what's possible. And I don't let them leave the practice with that. Because you have risk of them swallowing it and that kind of thing, or dislodging, but just for a few minutes for them to keep the trial smile in place to get some photos. And then we'll generally show them those photos, because that's a powerful tool, and when they see themselves in a photo with a new smile, it's amazing. One cool thing that I didn't share with you that I just learned recently at a seminar is to actually video the patient with their trial smile in and let them see themselves speaking with that. So another cool tip. So thank you again for your attention. I hope you have a great rest of the day, and see you soon.